The Life with a Preterm Baby series is the result of a collaboration between clinical and institutional experts at the Canadian Association of Pediatric Health Centers, Mount Sinai Hospital, and Sunnybrook Health Sciences Centre, as well as parent-led organizations such as Life with a Baby and the Canadian Premature Babies Foundation. We would also like to thank Prolacta Bioscience for sponsoring this series. Prolacta is the pioneer of human milk-based neonatal products to meet the needs of critically ill, premature infants in the neonatal intensive care unit. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can follow CAFC and the Canadian Premature Babies Foundation on Twitter, or join the conversation using the hashtag CAFCPresents or hashtag PremiPowerCanada. And for more information about premature babies, check out the Canadian Premature Babies Foundation and the Life with a Baby websites at cpbf-fbpc.org and lifewithababy.com. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAFC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive. Hello everyone, and welcome to today's webinar. My name is Doug Maynard. I'm the Associate Director at CAFC, the Canadian Association of Pediatric Health Centers, and it's my pleasure to welcome everyone back to our six-part series, Life with a Preterm Baby, that, as you noticed earlier, was sponsored by Prolacta Bioscience. This is the sixth and final episode of the series, and this has really been a great sort of test run that we had where we were we had Kate Robson, who's joined us on the panel again today, and you've heard her voice in many of the episodes, came and wanted to do a series that was targeted at providing information to parents and caregivers of preterm infants, and it's been really a great experience and a great success. We've had large audiences, great discussions, and it's really been great because we've had great presenters throughout. We've had Kate on the panel most of the time, and she's always great, and we've always had a great audience who's had lots of questions, lots of comments, and really interacted and drove a lot of the conversation, which is great. So as you saw earlier, please do type your questions into the question box as you think of them, because it's always one of the most interesting parts of the whole process is hearing from the audience. So we do have lots more information on the CAFC Knowledge Exchange Network for the rest of the episodes in the series. In case you did miss any of the other episodes, please do go check those out, as all of the recordings are available there. So today, as I said, is episode 6, and we are going to be talking about starting solids, what NICU parents need to know. And as always, we do have a couple of great speakers. As I mentioned, Kate Robson, who is a NICU family support specialist at Sunnybrook Hospital in Toronto, and is also the mother of 2 girls born premature, and Kate is home with one of those girls who's not feeling well today, so she's going to be muting and unmuting. So if we ask her a question and we don't hear from her, that's she may be otherwise occupied. She's also the Executive Director of the Canadian Premature Babies Foundation. And joining us today as our main speaker, we have Karen Weishuhn, who is a clinical dietitian at Mount Sinai Hospital in Toronto, and she's worked in the Maternal Infant Program for 10 years, starting first in obstetrics and for the last 2 years working in the NICU. So it's my great pleasure to hand now the virtual podium over to Karen Weishuhn.
Hi everyone, sorry, I'm just trying to see my presentation on my screen. Oh. Okay. So today I'm going to go over some basic information on introducing solids in premature infants, and I'm happy to take any questions that you might have at the end of the presentation. Oh, so I'm trying to figure out if I can, I can't see my presentation on my screen, so sorry. I've just managed to move everything down, so we're good.
Okay. Yeah, we see it fine here. So, and just I just wanted to mention you are just a little bit quiet, so if you can just maybe get a little closer to the phone or speak a little bit louder, that would be great.
Okay. All right, so what I'm going to go over is when we're looking at introducing solids. So what are you doing now? What you should be doing, and why we even talk about introducing solids, why we do it at a certain time, and why it's important to start looking forward to that when we want to introduce those solids. So there is guidelines for when we should be considering introducing it, specific to the preterm infant, what we introduce, and how we should go about doing it. And then at the very end, I want to end with a bit of a discussion about building on those basic informations and trying to make sure that you are achieving a healthy feeding relationship. Feeding from start to finish, whether it's breastfeeding, bottle feeding, or sitting at the table with your family, should be an enjoyable experience for everyone. And so we want to make sure that when you're starting introducing solids, you're starting from a healthy place for all involved. So by the end of this session, I want you to feel comfortable with the basics of this new stage in your baby's life and know what further information you might need to get from your healthcare provider or from other people in your community who might be able to help you. So all of the information or a lot of the information I am using comes from Health Canada and the Canadian Pediatric Society. So I've included the link here to the Feeding Healthy Term Infants. Now, obviously this document is based on, as it says, healthy term infants. So it's not as specific as what we're looking for preterm infants, but when we're looking at just general information about how to introduce, what to do, this is a really good reference for both parents and healthcare providers. Okay, so starting from the beginning, what are you feeding now? So the current recommendation encourages providing breast milk, or in the absence of breast milk, infant formula exclusively for, I've written here 6 months, but most recommendations are now saying between 4 and 6 months for introducing complementary foods. Breastfeeding is encouraged for 2 years and beyond. And I've included here just, so what if my baby is on a special formula or a higher calorie feed? And because I know that different NICUs have different practices and babies may be going home on specialized feeds specific to that baby. And for my part, I'm not really going to be able to answer too much about how long that special formula or higher feed should continue. That's something that you should be working with your particular pediatrician to see, or family doctor or healthcare provider to see how long that should continue and at what point you may need to make some changes. So why do we introduce solids? So introducing solids is for a number of reasons. First, we're doing it to improve nutrition. Not to say that there's anything wrong with the nutrition we've been providing up until this time, but when we're timing the introduction of solids, it's when baby's nutrition needs are starting to change. So when we talk about the term infant, we time introducing solid foods with when there is a decrease in iron stores for the baby. For the preterm infant, we're looking at it not as much from the stores of iron, because most preterm infants are encouraged to go home on an iron supplement, but we're looking at making sure that we are introducing sources of nutrition from the diet, but also to start developing the skill of eating solid foods. So learning to eat solid foods is a skill. It is something that some babies will take to very quickly and others will be slow to start. So it is something that we want to do at a specific time when it's safe and when baby will have the skills to start working towards this. And when we're introducing solids, we're doing it at a gradual process with the goal of working towards baby into toddlerhood eating the family diet. So when should we be introducing solids? Well, I'm sure a lot of parents out there have heard a lot of conflicting information. When it comes to preterm infants, the specific guidelines are hard to find. As I was going through this presentation, I was looking for different references, and to be honest, there's not a lot of research in this area. But what the most consistent recommendation from any organization, preterm infants should introduce solids between 4 and 6 months corrected age, or 4 to 6 months from the point they reach term. When I mentioned introducing solids as being a developmental skill, that's one reason why we're going to be looking at using corrected age. If we're looking at 4 to 6 months from birth, many babies would be developmentally not ready to introduce solids. At 4 to 6 months, a preterm infant should have the developmental skills to start tolerating this new skill. So how do you know where in that range to introduce? That's something that you would need to look at your baby, look at where they are developmentally, and also work with your healthcare provider to decide, is your 4-month-old showing developmental readiness for introducing solids? Then it may be appropriate to introduce it at that point. Or if your baby's not quite ready, then looking at revisiting it in a month's time. So some of the signs that your baby is ready for solids would be that they've reached their 4 to 6 months corrected age. They can sit up with support, meaning they can sit up in a high chair or whatever it is you're going to be using. So that doesn't mean they sit up on the floor on their own without propping, but that they can sit up with support of the high chair. They have head control, so they can hold their head upright. They can open mouth when food is coming towards them, and they can turn it away when he or she doesn't want any more food. They're able to follow the food with their eyes. They can close lips over a spoon, and they keep food in their mouth and swallow instead of spitting it out. Now, I always add an asterisk with this one. It's that they're able to do this. It's not that they're necessarily always going to do that. Most babies, when you put something new in their mouth, are going to spit it out at you. So it's that you know if they put it in, if they taste it, they are going to be able to swallow it instead of just letting it dribble out of their mouth. And the last point is that they're showing interest. Again, this one can be a bit of a gray area. I have some parents who will say, oh, my 3-month-old, they get really excited when they see me eating an apple. I think they're ready for food. And I always remind them, if it was a ball, would they be showing the same amount of interest? Sometimes it's just what you're eating is brightly colored, and that's enough to get their attention. But if they're sitting at the table with you while you're eating and they're starting to reach for food, they're starting to recognize that you're eating and trying to grab it, that's a good sign that they are getting ready to want some solid foods. So as I said, so how do you know when is it right for your baby? Around 4 months corrected age, or maybe even a month before, start having the conversation with your pediatrician or healthcare provider. Review your child's development and what skills they are achieving or not achieving, and then begin when they start to show those signs and they fall within that window of 4 to 6 months corrected age. If you have concerns that your baby is maybe not meeting these milestones and are falling within this range, that's another time to have a conversation with your pediatrician for specific guidance. So what are not signs for introducing solids? There are a lot of myths out there about what to do when you're introducing solids or why you might want to introduce solids. Now, I would say everyone has great intentions of helping parents out, whether it be to get more sleep or to get baby to grow, but it's not always that helpful. So a common one I often hear is that I was told to introduce solids because my baby's wanting to feed more often. My baby used to sleep 4 hours at a time, and now he's waking up every 2 hours. What this most likely means is your baby is going through a growth spurt. Growth spurts happen at a variety of times, and babies will want to feed at that time. When you look at breastfeeding is a supply and demand. So your baby may be hungrier, but your body may not know that yet, so may not be producing enough milk. So baby is going to work harder and harder to get that milk, and as your body responds, they can get what they need. So waking up more often does not mean that they need solid foods in order to help them sleep. It probably just means they're going through a growth spurt or one of the many other developmental changes that babies go through. Starting solids does not help your baby sleep through the night. This is something that good-meaning grandparents will tell you, lovely aunts and uncles, and even healthcare providers will tell you. This is not always the case. In fact, in some cases, I think back to my own son. He was a great sleeper, and as soon as we started solids, he decided that was when he'd stop sleeping. So starting solids is not a cure-all for all your sleep issues, and it's not a good reason to start. Again, looking back at the developmental readiness and the right age range is key. The other thing that sometimes I hear that I haven't included in my slide is baby's particular growth. So I hear it on both ends of the spectrum. My baby is so big, I've been told I should introduce solids because he's so big I'm not meeting his needs. And then on the other side, my baby's on the smaller side, so I've been told I should introduce solids early to help him or her grow. And again, that is not appropriate. I always like to remind people that healthy babies come in all shapes and sizes. Some of us are meant to be small, some of us are meant to be tall. Everything can be within the realm of normal. What is appropriate is for your baby to be following your baby's particular growth curves. And if there are growth issues, that is something to discuss with your doctor, but introducing solids early is not likely to improve those. In fact, in that time period, it is important that breast milk or formula be the number one source of nutrition. So what should you expect? So from 6 to 12 months or 4 to 12 months corrected age, what you want to start looking for is eating meals as a family. It doesn't mean that as you start out, you're going to be spoon feeding your baby while trying to eat your own meal. There is, some level of reality about what can happen, but having your baby become a part of family meals is important. You start out using solid foods as a complement to the breast milk or formula. So in the first few months, it really is just a small part of the diet. And as you get closer to 8-9 months, more of your nutrition is coming from solid foods than previously, and breast milk or formula should be making up less, still probably about half of the energy needs for your baby. You're going to slowly start introducing scheduled meals, start introducing all 4 food groups, and begin to introduce drinking liquids from a cup. So, what are we going to start introducing? So there's lots of recommendations that exist out there about what you should include, and a variety of them are scientific and non-scientific. So I'm going to go with what Health Canada and the Canadian Pediatric Society recommends. So our first foods should be a good source of iron. So that means starting with a meat or alternative or iron-fortified cereals. Starting with a source of iron is important for all babies because as we move from breast milk to formula, we are going to want to make sure that baby is starting to develop enough of a source of iron in their diet as they get close to that 1 year of age. So how we introduce a new food, we start with one food at a time. We give that new food for 3 to 4 days, and we look for any signs of allergy. And if you do see any, then you're going to consult your doctor and discontinue using that food until you have seen your physician. After 3 to 4 days, you can add a new food, again, one at a time, and wait. And again, looking for any signs of allergy. So as I said, that one food at a time, that doesn't mean, once you've introduced, let's say you start with chicken. Once you've introduced that, when you add a second food, you don't have to discontinue using the foods you've already introduced and know are safe. What you want to do is know that you're only introducing one new food. So if your baby does show a reaction, you can narrow it down to which food it actually is. So you start with one food at a time, using a small spoon and a small amount. If you were to start with an infant cereal and you look at the recipe on the box for how to make it, that recipe is going to be for a big amount. So don't put pressure on yourself to get that much into your baby. You want to use a small amount. I always suggest picking the best time of day when baby's well rested and happy. So for some babies, they are morning babies, and that's going to be a great time of day, so pick that. If right after they've had a good nap is a good time, pick that time. Pick the time where it's going to be most successful. Choose a calm and casual setting, so try to limit the number of distractions, so no TVs, no loud music. You want to be face-to-face with your child and talking to them and keeping yourself calm as well. And you want to feed at baby's pace. So if baby puts the food in the mouth and holds it there and thinks about it for a while, you want to let them do it. This is a brand new experience for them, textures in the mouth that they've never felt. It's going to be weird, and some babies take to it right away and they act like they've been waiting for this all their lives, and other babies are going to wonder what you're doing. You always want to stop when the baby has had enough. And if your baby refuses a new food, you want to offer it again in a few days, or sometimes you can do it the next day, just a small amount, but you never want to push a new food. So what next? So after you've started with your iron-fortified foods, you're going to start increasing other food groups. Typically, most people will suggest adding vegetables before fruits, and then including other grains other than your infant cereals, and then milks and alternatives. Most people will say start with vegetables because they're not as sweet, and if babies learn to like fruit first, they won't like vegetables. But most babies will go back and forth and will happily eat both. So I always say it's a good idea to start with vegetables, but there's no reason why you can't start with a fruit. And you don't have to introduce all vegetables before moving on to a fruit. You could pick a couple of vegetables, and once you know that your baby's enjoying those, then you could add in some fruit. So meats and alternatives. A lot of people were a bit confused when this recommendation came out, but the reason why we're including meats and alternatives is they are high in a lot of nutrients that are really important for a baby, and it is really important that they develop a taste for these and include them in their diets. So meats and alternatives are going to be high in protein, and another key nutrient for all babies, and specifically for preterm babies, is iron. You want to offer plain meats, avoid processed meats. And the one thing, now I'm going to be honest, it's been a little while since I've looked in the baby food aisle, but often there were meat and vegetable dinners. And I always would look at them and see that there's very little protein in them, which suggested to me that there actually was very little meat in them. It was enough that it tasted a bit chickeny, but there wasn't necessarily any meat. So there are some better products that will have significant amounts of meats, but that's when you want to look at your nutrition labels and compare. If there's only 1 gram of protein, it's probably, if the nutrition of the carrots and chicken looks very similar to the carrots, that tells you that it's heavier in the carrots, not so much in the chicken. And the other food I wanted to mention was including eggs, and this is one that people get a little confused by, because a lot of people are concerned about introducing a food with a risk of an allergy, and I'm going to talk a bit about that a little later in my presentation about introducing foods related to allergies. So some ideas of those meats and alternatives. So you can offer well-cooked, pureed, mashed, or finely chopped meats and alternatives. These can include tofu, beans, lentils, soybeans, egg, beef, pork, chicken, lamb, fish, really anything. So I just wanted to mention, when it comes to fish, a lot of parents will ask me, is it actually safe to include fish because of the risk of mercury? So Health Canada recommends that fish that are higher in mercury, which I have listed in my presentation, so your fresh frozen tuna, shark, swordfish, marlin, orange roughy, and escolar, you should limit to no more than 1 food guide serving, which would be about the size of the palm of your hand, once a month. These are not typical foods that most people would introduce to a baby starting out, but still worth looking at. Provincial and local health organizations often have more information available for you on fish that are more local. So if you're someone who eats fish that are local, who goes out fishing and wants to know what's safe to feed your baby, then you can contact your provincial or local health organizations, and they often have very detailed information on this. So how do you puree your own meat? Again, meats and alternatives are not always easy to find in the baby food aisle. Sometimes they're easier to just do yourself, and really it can be cooking a chicken breast or chicken thigh, pureeing it using a mixer with an amount of water or breast milk, and then serving it immediately or freezing it if you're not going to use it right away. And I have, half a cup and a quarter of a cup of water, but this is by no means an actual recipe. This is something that you can play around and learn what texture works for you to feed your baby. Also doesn't mean that you necessarily have to use purees. You can finely shred meat and feed that to your baby as well. So iron-fortified cereals are another option for foods that are high in iron. And this used to be our go-to first foods, but now we're putting a lot of emphasis on using the meats and alternatives as well. But that doesn't mean that you can't use an iron-fortified cereal. These are convenient, they're great, they're pretty easy to use. So what you want to do is always feed it from a spoon. So again, one of those myths out there will be to put some cereal into your baby's bottle, again, often with the promise of your baby sleeping through the night, and we don't recommend this. And there are some babies who may have this recommended due to other feeding issues, and that would be a separate situation. But from a strictly introducing solid nutrition standpoint, we want your baby to be fed with a spoon or fed by themselves. So the options out there would be rice, barley, oatmeal, soy, wheat, and mixed cereals. So again, just considering introducing each one of these separately and giving yourself 3 to 4 days before introducing another. So what that means is the mixed cereal will have a combination of different grains in it, so you would not want to start with that until you know your baby has tolerated all of the other cereals. When it comes to the infant cereals, I recommend choosing a variety that is made mixing with breast milk or formula rather than just add water, because then again you're controlling what's added to it, and you're also giving a bit of extra nutrition by including the breast milk or formula instead of the water. I've also included here trying to use a plain cereal, no added fruit. Now that doesn't mean that as you go along you can't add things to the infant cereal, but there are some brands that have some added fruit varieties, and typically these have some added sugar and other things with it that aren't necessary. Some babies will love infant cereals and some will not, but often if you mix it with carrots or with some fruit or with another food that your baby likes, then they will take it. So when you're starting out, you're looking at using probably no more than 2 to 4 teaspoons 1 or 2 times a day in the first little while. So then when you move on to introducing vegetables, so vegetables are a great source of nutrition. You're adding more vitamins and minerals, a whole variety of vitamins. You're adding some fiber into the diet, and you're adding some color, which is really important and exciting for babies. They often get very excited when they see different colored foods. Most people will suggest starting with mild tasting vegetables, but this again is not science. This is just a piece of advice, because some babies will adapt better to more mild tasting vegetables, but then for every baby who prefers carrots, you meet a baby who prefers broccoli. So there's no rhyme or reason necessarily. Once you've introduced a few of those iron-rich foods, then you can begin to offer either pureed or soft small pieces of cooked vegetables. So some of the more mild-tasting vegetables are butternut squash, acorn squash, sweet potatoes, green beans, yellow beans, carrots, and peas. And some of your stronger-tasting vegetables I've listed here, including broccoli, cauliflower, asparagus. I always encourage parents to try and include vegetables that they wouldn't necessarily eat themselves. You want to expose your baby to a whole variety of tastes. The more tastes they get used to at this stage, the more foods they're going to be open and willing to eat as they grow up. So fruits, again, you're adding vitamins and minerals, again, a lot of fiber, and some sweetness. This is a sweeter tasting food that you're adding. So you're adding a whole new taste to their palate. So once you've introduced a few of those iron-rich foods and some vegetables, you can begin to offer some pureed or soft pieces of fresh frozen cooked fruit. Someone pointed out when I was looking at my presentation, when I say frozen, I mean defrosted, not actually frozen, but you can freeze some fruit and then puree them afterwards. So you want to look for, if you're buying store-bought, you want to look for some pure fruit, so meaning not fruit desserts. Not looking for foods that don't have any added sugars. Babies don't need that. They're learning the tastes of foods and they will adapt to it. And if we add sugars to their foods, then that's what they're going to come to expect. So again, I've just listed a whole pile of fruits here. Lots of them are very popular with babies, but the variety that exists out there, you can introduce any of them to babies. So milks and alternatives. So milks and alternatives we're going to wait to introduce until a little bit later. There is, again, a bit of conflicting recommendations around when to introduce milks and alternatives. But when we're talking about drinking whole milk, Health Canada recommends waiting until after 9 months, but most recommendations say that around a year we can start switching, and again, looking at a year corrected age, looking at introducing whole or HOMO milk. So your milks and alternatives are going to be high in protein, calcium, vitamin D. When you're choosing any kind of dairy product, whether it be yogurt, cottage cheese, or milk, we're going to want to choose the highest fat versions. Infants need high-fat foods. We don't want to choose a low-fat dairy product. And I've put a thing down here where it says there's such a thing as too much of a good thing. The reason why I've put that is that it's not such a concern when you're first introducing solids or when you're first introducing things like yogurts or bits of cheese. But often when we look at 1 year to 18 months, when babies are switching from drinking drinks out of a cup and eating more solid foods. If babies drink too much of their whole milk, then we can see that they don't eat enough food. And this can impact growth and it can impact overall nutrition. So I just want to point that out, that when we're introducing whole milk into the diet, it is to be a small part of the diet, not something to use to fill baby up. And I'll give you some guidelines a little later on. So texture progression can be a challenge for all babies. There is a window of opportunity, and most recommendations are that we should be introducing some lumpy texture foods by 9 months corrected age. So that I'm saying 9 months corrected age, but there really isn't a lot of research around the difference in textures when it comes to preterm infants versus term infants. So when we look at the term infant, the recommendation is that lumpy textures need to be included before 9 months corrected age, or it may impact a child's ability to tolerate these textures as they move on. But what age do we start thinking about adding more textures in finger foods? And that is an important thing to think about. If you're making your own foods at home, lumpy textures are probably going to be there from the beginning. It's hard to puree to the industrial standards of store-bought foods. But as soon as your baby is able to pick up finger foods, they are able to start eating finger foods. You just want to make sure they are small enough. So as I said, you can start by grating small pieces of meat, and you're helping put them in baby's mouth. Up until the point where they're able to do that skill. It can be a hard thing and a nerve-wracking thing to start to introduce different textures, and babies don't always love the lumpy, pureed kind of foods, and when you actually let them have more control and do finger foods, they're often happier. So by 9 to 12 months corrected age, baby's now able to chew up and down. It doesn't mean they necessarily have teeth or enough teeth to be that effective, but they're able to gum food, and that's good enough. They're able to grasp finger foods. Again, this is when we're talking about the corrected age, this is to do with developmental stages. And when they're able to grasp those finger foods, they should be able to start feeding themselves a bit more. They're watching and copying what other people are eating, and they want the foods that other people are eating. So they're going to start stealing foods from your plate. And you should be prepared for a mess. It's going to be fun, but foods are going to go flying, and babies are going to be covered in food when they're suddenly in control. It's a good time to get some cute pictures. So I've listed here just a number of different ideas for finger foods. So soft or grated vegetables and fruit, scrambled eggs or cut up hard-boiled eggs, beans, lentils or chickpeas, tofu, pieces of toast, noodles, roti, Cheerios, unsalted crackers, grated cheese, basically anything that you can make down to, about the size of your pinky fingernail. So we don't want things bigger than about 1/4 of an inch. We want to reduce the risk of choking. And you want things to be soft enough. Again, they don't have enough teeth to chew anything too hard. So we want it to be soft and we want it to be small so that there's no risk of choking. So I've just listed here a number of foods that you want to be very careful with because they are at including them would be an increased risk of choking. So peanut butter may be a bit confusing, but it's often peanut butter on something or just hunks of peanut butter. Raw vegetables, grapes are a huge risk of choking, and the recommendation is really to cut them to into quarters and then into halves as your child gets bigger, up until about 4 years of age. Nuts, seeds, popcorn is a huge choking risk. Hot dog wieners, raisins, and smaller hard candies. So I know most of you are thinking, well, I'm not likely going to give these to my child in the first few months, but these are foods that may be lying around or maybe at someone else's house that you don't expect. So just things to keep an eye out for. But choking and gagging are two different things, and that's important to be aware of. When a baby tries a new food, they may gag. When a baby tries a new texture, they may gag. Gagging is a normal part of learning to eat. So gagging means that your baby has tried to swallow it and for whatever reason is bringing the food back up. It is a natural reaction, and it's actually a good reaction. It's how your baby is stopping him or herself from choking. So as long as it doesn't frighten you, it's not going to frighten your baby. So trying to stay calm when your baby is gagging up a food, and recognizing that this could be because they don't like the taste, because they just swallowed it a bit wrong, or because the texture is new to them. So I've included this slide, and it's actually blank. So how much does my baby need? And I've left it blank because there's no real good answer to this. Every baby is going to be different, and the important thing is to let baby determine how much and how to progress how they're eating. I've also included a slide about liquids. This is a question that I often got asked a lot. When can I introduce water? When should I introduce juice? And what kind of cup should I be using? So there's no need to introduce too many liquids. When you think about it, breast milk or formula are still providing most of your baby's hydration and also a lot of the baby's nutrition up until 1 year. However, a lot of parents will start to include some water as their baby's starting to eat more and more solids, especially as we get hopefully closer into the summer months. So it's absolutely fine to start thinking of including some water, as you're introducing solids, sort of past that 6-month point. But what we don't want to do is include juice. So juice offers very minimal nutrition. What it really offers is a lot of sugar. So it's not something to include in your baby's diet. There's also a new recommendation around using an open cup versus something like a sippy cup. So Health Canada, in fact, put out a recommendation around what type of cup to use, and they've encouraged as soon as you're starting to include cups that you should be using an open cup with your baby. Now, this may make for a bit more of a mess as your child gets older, but it is a developmental skill, and most babies from a very young age are able to hold a cup and start to tip it up towards their face. So in the beginning, you would be helping them with it, but then by the time they've been doing it for a couple of months, they will be able to do it themselves. And we're encouraging parents to switch to using a cup from a bottle by 12 months of age. When I talked about too much of a good thing around milk consumption, babies who are drinking milk from a bottle will tend to drink more than if they were drinking it from a cup. And because we know that it can take the place of other foods in their diet, we don't encourage that. The longer you include a bottle, the harder it becomes to wean your child off of a bottle. So if you are using a bottle, start to consider switching to a cup by that 12 month of age. And if you're introducing whole milk, then using a cup right from the beginning so that your baby doesn't get used to it being in a bottle can be helpful. So the only foods that we really recommend limiting for babies would be any foods that are high in sugar, and that means added sugars, any foods that are high in salts. So not adding salt to any of the foods you're giving your baby, and making sure any of the foods you're buying are not adding it as well. Avoiding raw meats, fish, and eggs. We're just looking to prevent any foodborne illness, any unpasteurized dairy products, and honey is also on this list to avoid, again, it's related to foodborne illness, and to delay using it until after 1 year of age. So in the past, people would avoid introducing certain foods until after a year because they were looking at reducing the risk of your child developing an allergy. The latest research has suggested that there isn't any benefit to delaying the risk of any particular foods, and in fact, there is now a thought that possibly we may be increasing the risk of foods by delaying the introduction of some of these foods that have a higher risk of allergy. So some of the foods we're talking about are things like egg, fish, peanuts, nuts, and seeds. So we say after 6 months of age, you do not need to avoid any foods for the reason of allergies. So any of these foods can be introduced in a variety of ways, offering one food again at a time, early in the day, waiting 3 to 4 days before starting another food. And again, watching for signs of allergy, which can include diarrhea, vomiting, skin rash, hives, swollen face, or tongue. So if you ever have any of these symptoms and you're concerned you started a new food, it's worth talking to your doctor. If you have a family history of allergy, or your baby has had an allergy already in life, again, I would talk about the recommendations for your specific situation with your healthcare provider. So again, parents often ask me, what is better? Should I make my own food or should I buy my own food? There are benefits and disadvantages to both, and there's nothing wrong with doing one or the other or some combination. So benefits to making your homemade foods: you get to have control over what you're going to offer. You can offer a whole variety of foods. You can introduce foods that your baby is going to be exposed to within your diet. So there may be foods that you eat that you will never find in a tin or in a jar in a baby food aisle. So that's a huge advantage. Also, you get to control the texture. You don't have to puree it as finely, so babies will get used to different textures. On the other hand, you have the main disadvantages. There's time that it takes to make it, the mess it takes to make it, and just sometimes the convenience. So to me, there's positives and negatives about both, but as long as you're encouraging your baby to have a variety of sources of nutrition, a whole variety of foods, that's what's important, more important than where the food comes. If you are making your own food, you want to always keep in mind food safety, wash your hands well, clean the equipment properly, make sure there's no cross-contamination. Don't leave cooked food sitting at room temperature. So once it's made, cover it and refrigerate, and then freeze any food you're not going to use right away. So lastly, I just wanted to talk a bit about developing a healthy feeding relationship. So feeding should be an enjoyable experience for everyone. And if anybody's fed a toddler, they know that's not always going to be the case. But learning how to kind of approach it from an equal partnership can make the stress a little bit easier. So things to think about from your own history. So were you ever made to eat all of your vegetables, clean your plate before you could have something you liked, have one more bite, or made to eat more than you felt you were hungry for, or not given as much to feel full? I'm sure all of us at some point were encouraged to take one more bite or have done it with our own kids. But these are things that we really encourage you to avoid as much as possible. It's really important that feeding is a relationship of trust. You have to trust that your baby really does know what he or she needs in order to grow appropriately. And your baby needs to be able to trust that you're going to provide the foods at the time that they expect it, and that beyond that they're going to be responsible for what to eat. So I've included a slide here that is talking about whose job is what, and this all comes from a dietitian in the States named Ellen Satter. Her website is filled with resources, and I've included this one here, which is the Divisions of Responsibility in Feeding, and it's a great resource, and for children of all ages, she has some great recommendations. So we all have a job when we come to the table. So when you're feeding a baby, you are responsible for what food is offered. So you get to choose what food to bring to the table. You get to choose when food is offered, and you get to choose where. So choosing a calm environment, making sure there are no distractions, and that means also not trying to distract baby in order to get more food. The children are responsible for how much they eat and whether or not they eat. Okay, so it really becomes that trusting that if they are not eating that much right now, they're going to make up for it later on. That's a lot easier said than done, and I acknowledge that for sure. But it's something that every once in a while it's good to remind yourself. They really do know what they need, and we need to learn to trust them. So you have the job of providing the healthy and satisfying meals and snacks, and then after that, the rest is going to be up to your baby. So making mealtime calm and quiet, making it family time. So this may, if you have other children, may take away from the calm quiet, but having them joining family meals allows you to model healthy behaviors. It allows you to show them that, we all eat a variety of foods and that we all sit together and that eating is part of being a family. No feeding with distractions. So that means trying to avoid any unconscious eating. I've heard a lot of parents who say, my child won't eat, but if I put the iPad on and, put Barney on, they will let me just shovel whatever I want into their mouth. And while in the moment that may feel great, it's not teaching them how to eat. It's not teaching them to develop the skill of learning how to eat. And it's also not trusting that your baby knows whether or not they're hungry. So that means trying to avoid tricks to get baby to eat more, avoiding the airplane, avoiding, flying the food into the mouth, avoiding things like that. Now, one thing I do often say is sometimes when baby stops eating, they may just be done eating that particular food. So when you get to the point of adding in multiple foods, so let's say you're feeding a bit of chicken and your baby's refusing to eat that, that may just be it's time to move on to the carrots now. So as you move through this journey, you will learn your baby's cues and your baby's sign and what works for them. But it's always supposed to be done in a respectful way. So really learning baby's cues and what baby wants in that point in time. Oftentimes, when a baby doesn't eat very well, after a day, you usually can look back and see why. Oh, baby didn't have a good nap. Oh, a tooth just popped out. There can be all kinds of reasons why your child isn't eating on that particular day, but often you can't realize it until after the fact. It's always good to remember that food is meant to nourish and to be enjoyed, and that's by everyone in the family. So I was asked when I was asking other people what to put in this presentation, someone said, oh, I always want to know if my baby's growing normally. Can you put in a slide to talk about normal growth? And there really isn't a good slide for this. Normal growth means that your baby is meeting his or her particular growth needs. So this is something that you should be talking about with your healthcare provider. we use growth curves as a way of looking to make sure baby's not going up or going down on the curve, and should be in general following along their growth curve. And so that's something to just review. If you have concerns around growth, ask your doctor to see the growth curve and to talk about it with you. And as you go through introducing solids, it's something to bring up as you move along. So milk alternatives is something that we've been asked about a lot here at Sinai. And this is, when you're looking at a baby who you're unable to introduce cow's milk at 12 months of age. So this would be a situation where baby maybe has a diagnosed cow's milk protein allergy, or maybe in a family where you're vegan and you're not wanting to introduce it. The recommendation is to provide breast milk or formula if you're not introducing whole cow's milk until 2 years of age. So I put here a hypoallergenic formula. So if you're doing it for allergic reasons, then you'd want to continue that specialized formula. Soy milk is not recommended as the sole milk source until after 2 years of age. And other milk alternatives like almond milk, rice milk, or other options are usually low in fat, protein, and do not meet the nutritional needs of a baby before 2 years of age, so should not be used. So beyond 12 months, you're moving towards regular scheduled meals and snacks, making sure foods from all food groups are included, a variety of textures, finger foods, baby using their own spoon and self-feeding, breastfeeding, or giving about 500 mils or 2 cups a day of homogenized cow's milk, baby being a part of family meals and eating family meals, and modeling healthy eating yourself so that baby and any other children are learning healthy eating from the family. If you feel that your baby's not meeting any of their milestones, or you feel like they're not eating as well as you think, this is something that's worth bringing up to your family doctor, your nurse practitioner, your pediatrician, or whoever is your main healthcare provider. There are lots of people in your community who could be involved in your sort of feeding team if your baby is not following the progression you expect. So whether it's an OT or SLP because your baby's having texture or swallowing difficulties, or a registered dietitian because your baby's having some growth challenges. Ask your main healthcare provider to link you up with resources in your community. So that's everything from me. So I'm open to any questions if there are any that have come in.
All right, thank you, Karen. A great presentation, lots of great practical information there. The first question that came in was, and I think this is an opportunity for you to clarify something. I think there might be a bit of a misunderstanding here. It was back when you had a slide where you were talking about speaking to your physician or your pediatrician at around 4 months to start the conversation about when to start solid foods. So the question that's being asked is saying Health Canada and the Canadian Pediatric Society all recommend 6 months to start solid food. So, and you are now saying 4, and I think in your slide you said 4 to 6 months corrected age. She says, is this a new recommendation? Historically, it has been said that a baby gets all the nutrition they need until 6 months for breast milk, etc. It has been shown that by introducing solids earlier than 6 months, infants may decrease their breast milk rate intake and their digestive systems are not ready for introduction earlier than 6 months. So just maybe some clarification around that 4 to 6 months, the slide that you were talking about.
So absolutely. So Health Canada's recommendation still does say 6 months. And what we're seeing is, so that's based on the World Health Organization, which jumped their recommendation from 4 to 6 months, I want to say about 14 years ago. And now a lot of organizations and a lot of people in practice are looking at moving it, saying that it probably is somewhere in there, and it really needs to be baby dependent. So while 6 months corrected age is still sort of the general recommendation, when I was doing my research around the preterm infant, there's not a lot of really concrete organizations with specific guidelines looking at European recommendations around term babies, they are saying 4 to 6 months. And looking at when it comes to the preterm infant, we know that 4 to 6 months, when we look at also how the age of the baby, that is, looking at, depending on when the baby was born, a much longer term. And a lot of research with preterm infants has looked at, when are we worried about increasing the risk of, allergies, so not introducing too early because of any risks of introducing too early, but also not wanting to delay it too late, again, because of texture issues. And so most recommendations specific to preterm infants are looking at that 4 to 6 months age range, but saying that with the caveat that you really need to look at your baby's developmental abilities at that point. So some babies may be ready at 5 months, and some babies are not going to be ready until 6 months. But also saying we don't want to do it before that 4-month point. Even if the baby is 6 months of age, we don't want to consider it before that 4 months corrected.
Thank you very much for that. Yeah. The next comment that came in, or comment and question, so this is from a parent who says, I got so focused on growth in the NICU because there was such a focus on weight that she thinks she may have anxiety around eating that is causing her baby problems. She says she's always worried about adding extra fats into foods. She said her baby is 1 year corrected and is fine on his growth curve. He's a fussy eater with her, but fine with his dad. So her question is, how does she make food fun again? She says she has guilt around this.
I think that's a really great question. And that this is often something that I felt, we in the NICU, we focus so much on, how many meals are going in and how much weight the baby's gaining every day. And then you go home and we leave you to kind of sort things out yourself. And I know from talking to parents that can be a huge stress. And definitely, as you progress to solid foods, it becomes a bigger challenge. And I think, part of this is being the parent of a preterm baby. We've, what you've gone through and all of the challenges around growth, and part of it is just being a parent. So I think, a lot of parents feel this same pressure. I think really it is sort of just trying to take a step back, looking, your baby is growing well, so that's wonderful, and taking a step back and saying, you know what, I need to trust my child, and I need to have them learn to do this, and it is taking that pressure off and taking yourself out of the picture. It is, as I said, it is so much easier said than done, but really it becomes putting the food in front of your child and sitting there, and whether it's talking to them or singing with them or doing things to distract you from how much they're eating. And knowing that if your child doesn't eat enough at lunch, they will make up for it again at dinner. Babies should eat differently at different times of the day, and it really is just sort of taking that pressure off of yourself. And I think it's really good to acknowledge, you see a difference when your child eats with someone else versus you, and so looking at your own behavior around how they're eating. So thinking of things like, don't point out the food to them. Don't even encourage them to try something. Just put it down in front of them and see how they do. I've seen the same thing with my own kids. They will eat fine, and if I say, and make sure you eat your carrots, all of a sudden they decide, I don't want to eat those carrots. It becomes a power struggle. So the more power you try and put in, the more they're going to put in as well. So really just put the food down and talk about anything other than food with them. Let them decide and let them learn this skill. Even at 1 year, it really is as much about developing the skill and developing the love of eating that's going to be more important as they go forward than individual meals getting exactly what your child needs. So really take that pressure off of yourself and know that you're doing a great job, and just try try every day to just encourage and enjoy the eating process.
All right. The next question is coming from Katie, who's asking, how do you know when to use or continue iron supplements during the 12 to 24 month age?
That's a good question. So I know at Sinai we recommend continuing the iron supplements up until 1 year corrected age, and then at that point we usually leave it up to the pediatrician. So I would say that's a good point to have a discussion with your pediatrician or whoever your main healthcare provider is, and that is a time where you want to look at things. So you can tell them, you know what, my child's not doing really well with meat, not loving, other sources of iron. So looking at the diet and saying, what sources of iron do I have in his or her diet, and reviewing it with your doctor and seeing if they feel that's enough. If they don't feel it's enough, then they may encourage you to continue using iron supplements. But I always want to say, make sure that we don't use those iron supplements as a reason to not try to include those foods. And so I feel like in some ways I'm going to contradict what I just said about not putting any pressure on particular foods. But it's not saying that you're going to put pressure on eating those meats or alternatives, but it's just saying that you're making sure you're offering them. And then if you notice your child is not taking too much of, not taking too many of the meats and alternatives, that's something you report to your healthcare provider. And so then they can decide with you whether or not you need to include the iron supplement as you go forward.
All right. The next question is asking about, if you do have to boost caloric content of foods, what's the best way to do it?
Oh, that's a great question. It's a very hard question to answer in a very general nature. Because when I meet with parents who have a child who's not growing, there's a lot of different ways we can look at doing it. I would again suggest, if you have available in your community, meeting with a dietitian who can actually look at your particular situation and work with you would be ideal, but I know that's not always reality for everyone. So things to look at are just making sure that you are getting balanced nutrition, making sure that when you are choosing dairy products, you're choosing high fat dairy, and including that as in all of the meals. So that means choosing a homo milk, choosing yogurts that are high fat. I mean, I've seen a yogurt that's like an 11% fat, which is a plain yogurt, which is actually quite delicious. So looking at labels and trying to find those higher calorie foods, and it really is just looking at making sure a child is exposed to some of these foods. And then oftentimes when we find that babies are, whether they're eating adequately or not, and getting a variety of foods and they're still not getting enough calories, then we look at calorie boosting. So by adding sources of calorie into the foods they're already eating. So whether it's adding fats and oils into cereals, into other foods they're eating. But again, that would be something that we would do on an individual basis.
Is there a role for things like Pediasure or similar products in this case, or any other area? Is there any point where you would recommend something like a Pediasure or something like that?
The challenge with something like Pediasure, so while it may provide some protein and some vitamins and minerals, is it can become a bit of a crutch. So for sure there are situations where it may be appropriate, but oftentimes if you find your child isn't eating enough and you give them Pediasure, their bodies start to learn that they're going to be given something if they don't eat. So oftentimes, if your child only eats a bit at dinner and you're worried that they're going to be hungry, so you give them Pediasure, then they start to learn that they're always going to get that afterwards. So it's a bit of a fine balance. between you making sure they're getting adequate nutrition, but then also making sure they are still growing. So that, again, before I would use any kind of supplements, I would always work with my doctor to make sure that, if you see that your child's eating a pretty balanced meal, but they just don't seem to be growing, then looking at adding that in, or again, trying to meet with a dietitian who can also work with you. That may be a good option, but always if you add something in like that, be cognizant of whether it then means your child decreases the solid foods they eat. So some parents might say, okay, I'll give it as an afternoon snack after their nap, and they give it, and it's higher calorie than their snacks, so it would have normally been, so that seems like a great idea, and then they're not hungry for dinner. So that's something to just be aware of before you use anything like that. Again, I would always work with your healthcare providers before going to something like that.
All right. Now we are a little bit over time here. We do have a few more questions, so I think we'll try and get through all of them, but I'm not 100% sure we will, because we are about 5 minutes already over time. But we'll start with a couple more and see where we get, if that's okay. The next question is around. She's asking, what are your thoughts on baby-led weaning? She goes on to say an approach to starting solid foods by jumping straight to finger foods and bypassing purees. She says a lot of parents seem to be doing this now.
Absolutely. So I knew I would get this question, and to be honest, it's not an area that I'm completely well informed about. But it is definitely a hot topic these days, and something that parents are moving towards. I think my biggest recommendation is to do your research. Make sure you feel comfortable with it. Make sure you're doing it safely. Is it research has shown, so there is some research coming out about baby-led weaning, that it can be just as nutritionally adequate as any other form of introducing solids. So in that way, that's great. What you're really looking at is making sure foods are appropriate sizes so that you're not increasing choking risk. So making sure that things are either big enough that your child can hold it and use it, and are able to kind of gum off small pieces, or that they're small enough that they're finger foods and not going to choke. Those are the kind of key things I would look at. But I would recommend, it's a big thing in the UK right now, and I know a lot of parents are moving towards it. So I would just suggest looking for resources. Unfortunately, I'm not a big expert on baby-led weaning. But even Health Canada is acknowledging that that we need to be focusing a bit more on texture progression, because if we keep babies on fine purees for too long, then we're noticing kids will have aversions to textures and will have a harder time moving to solid foods. So baby-led weaning is one way of dealing with this.
All right. You did mention in your one slide where you were talking about preparing the pureed meats, and you mentioned that you mentioned covering and freezing cooked meat immediately if it's not going to be eaten right away. Sari's heard that cooked meat should cool before being refrigerated or frozen. Is that something that people should be aware of, an extra step there to let it cool before it's frozen?
It sounds like a good recommendation to me. I don't think there's a harm in cooling a meat in the fridge for itself. But I think the main point is just making sure that it is being frozen and not kept in the fridge for days. And just paying attention to food safety.
The next question is asking, is it possible for a baby to overeat once they start solids? She says her baby takes in too much formula, as per her doctor, about 1 liter a day at 3.5 months, 1.5 months corrected. She's been told to space out his feeds more and try to limit with slow feeds and a pacifier. She's worried she's not letting him control the amount, as you've been suggesting, and that this may become a pattern. She says her other preemie twin does not have the same issue.
I think it's very hard for me to comment when when another health care provider who actually knows the baby has seen who's followed the growth and has seen the this particular child. But in general, I'm a big believer in that babies know what they need, and they will follow what they are supposed to follow. And we often get focused on birth growth percentiles, but birth growth percentiles aren't always where baby was meant to be, whether it's higher or lower. So sometimes there is a point where they may go up a bit or may go down a bit, and then find that curve and follow it along nicely. I mean, I think the fact that you feel your baby is queuing for food is important, and it really is just looking at, what I would recommend is finding a balance between your physician's recommendation and what you really feel comfortable with, and looking at, is your child crying because they're hungry, or are they crying just because they need to be soothed? And if you feel comfortable that you have soothed the baby, baby's been changed, baby's not overtired, if you know other things are not going on, and your baby is showing signs that they really are hungry, then it really is just like going with what your baby said. Again, I would add, not knowing the baby, I don't know the particular situation, but I would also sit down with your physician and maybe review the growth charts and see how your baby is plotting on the growth chart. And even if your baby was premature, if you have the baby's growth chart from in hospital, or if you kept track of the growth in hospital, even bringing that so you can look at how your baby grew on premature growth charts, they may be following the same pattern that they had been all along.
All right, and here's the last question that we have in the list. Katie's saying, if your babe slips on their growth curve around 15 months corrected, and you feel that you're doing okay with offering enough and appropriate foods in a responsive and relaxed setting, what would be some of the usual first places that you might investigate to explain the slip on the growth curve?
That's a good question. Well, I mean, there are a few things to think about when we look at growth curves. We are looking at 3 different measures. So we can get focused on weight a lot because it's the easiest one and we get it most often. But it's important to look at length and head circumference and make sure your child's growing in all ways. If your baby's growing lengthwise and the weight has dropped off a little bit, sometimes we see weight drop off around the time babies start walking and are becoming more mobile. They're on the move a lot more. They're using more energy, so that may just be a normal part of their development. If it's a drop, we usually get concerned if they're starting to cross percentile lines. So if they've gone from the 50th down and now they're hovering around or below the 25th, then we would start saying, oh, okay, this is a drop. What is going on? So I really think it is looking at, am I offering a variety of foods? Am I offering meals and snacks? So, breakfast, morning snack, lunch, afternoon snack, dinner, and then maybe or maybe not an evening snack. And am I looking at how much milk you're providing? So again, when we provide milk, if we provide large amounts of milk, so looking at more than that 500 mils a day, oftentimes that can take the room of other foods. And so sometimes when we see babies who aren't gaining enough weight, it's actually that they're filling up on milk and not getting enough of other foods. So looking at how much milk they're getting, and then just overall, are they getting a balanced diet? If you feel that they're ticking all of those boxes, developmentally they're doing fine. Again, have a conversation with your pediatrician, but barring all of that, there may be no cause for concern. This may just be a normal part of their development, and it's just a matter of following it along and keeping a close eye on it.
All right. And with that, I think we've exhausted the question list. We haven't heard anything from Kate, as I mentioned earlier. She's been trying to mute and manage some children at home. So, Kate, I'm not sure if you have anything you'd like to add or share at this point.
Really, I want to say thank you. What a wonderful presentation. And again, with so many of these presentations, what I want to do is go back in time and do things a lot differently with my own kids. But I think it's so many good reminders to just be focused on your children and cueing into what your children are telling you, and remembering that food should be fun and eating should be enjoyable. So Karen, thank you so much. What a wonderful way to end this series. I'm just so grateful to you for your time and your expertise.
You're welcome.
All right, and with that, we will wrap this up. As Kate mentioned, this is the end of the series, of our 6-part series. Lots of, all of the episodes, this one included, will be on the CAPC Knowledge Exchange Network, so you can go back, watch them again, catch up on the parts that you might have missed, share them with anyone that you think might be interested. I will let you know that Kate and I have talked about potentially trying to continue this series. I mean, we started with the 6-part series. The topics were so great. People have been telling us there's so many more things they want to hear about, so we are going to see if it might be possible. Keep your ears open around September. Perhaps there might be we might be have the opportunity to start up a new series with a whole new set of topics. So because it's been such a great series. So again, thanks to Karen, great presentation, and thanks to Kate for all of your help throughout this whole series. The Canadian Premature Babies Foundation and all of the other folks from Mount Sinai and Sunnybrook that participated in and presented and supported and shared, and all of the audience that contributed. It's really been great. All right, so thanks again. And if you do want to see more webinars, we do have a regular webinar series every Wednesday with CAFC. It's not always focused on premature babies. It's focused on a lot of other things, but you can always sign up for our email distribution list, and there may be other things that you find of interest. So hopefully we'll see you back here at one of our other webinars, or maybe in the fall when we start a new series. Thanks again, everyone. Bye. You still there, Kate?
I am.
All right,
And Karen, are you still there?
Yeah, she signed off for her computer. She must have hung up the phone too.
Okay,
That
that was
overtime. Maybe she actually had work she had to go do.
Thank you. I just wanted to say again, thank you so much. It's just been wonderful, and I think a lot of good information. I love that these are recorded and that we can continue to share them with families. Yeah, she was absolutely wonderful. So thanks, and we'll hopefully be in touch soon about having some more fun starting in September.
All right, sounds good. All right.
Thanks. Bye-bye.
Bye.